Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of November 13th, 2023. After a COVID status update, I will discuss COVID disparities and issues with the pulse oximeter device. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. COVID is still with us. It's still causing sickness, disability, and death, and there is still a lot we don't know. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. For our COVID status update, first, taking a look at wastewater, looking nationally across the United States, we can see that there are increases. Those are depicted in orange and red on the CDC's graph. And right now there's just a little over 1,100 wastewater sites reporting nationally. So it makes it harder to really glean things overall, but we do see a little bit of a trend upward leading up to late October there. And this is where I recommend that if this is of interest to you, you find a site that is reporting near you. And in general, find that site and stick with it. I've linked 4 different resources in the post. I've been using the Verily site to look in my area here in Oakland, California. And unfortunately, we're already seeing an uptick of SARS-CoV-2 in wastewater. It had been coming down for about 6 weeks since about mid-September, but so far in the month of November, it has been steadily increasing. So that tells me a little bit about what I need to know locally. And of course, we never like to see increases. Taking a look at percent positivity again nationwide, we can see that it has been coming down since the most recent peak, which was just a couple of months ago in late August. And we're now around 9% positivity. That's actually of October 28th. And that's based upon somewhere in the 70 to 80,000 tests per week being conducted range. So the number of tests being conducted is kind of holding steady. So, but in terms of percent positivity, we're still more than double where we were just this past June. And what I don't like is that we seem to be leveling off a little bit here. I would really like to see this come down further before heading back up, as we expect it to do as we get it more into the winter months. And with wastewater already seeming to tick up, we're just going to have to wait and see. And taking a look at emergency department visits, unfortunately, we are seeing a bump right now in emergency department visits with diagnosed COVID-19 in the U.S. And remember that this is our most updated indicator. Here it's updated through November 10th. And this had been coming down since the peak we had in late August. And it is coming down, as you could see, slower than it went up. And I was complaining last time about it seeming to plateau. And now, unfortunately, it even looks like it might be bumping up. So I'm hoping that's a blip, but never like to see emergency department visits plateau off and then seem to increase. So we're going to have to keep an eye on that. Hospitalizations are slowly, very slowly trending down. This is the 6th week in a row of creeping down slowly, again, coming down more slowly than it went up. We're still over 14,000 new weekly hospital admissions for or with COVID. So this is still more than double where we were for most of the month of June, just this past June. So this is still a lot of people every week being admitted for or with COVID. And what we've seen in all past waves is that increases in hospitalizations hits after the increases in emergency department visits. So we'll continue to monitor this, but for now, at least glad to see it coming down, even if it is going slowly. And so we're finally no longer climbing in terms of weekly deaths, but it is roughly unchanged, essentially. We're still at about 1,200 deaths for the week ending October 14th. Still quite a lot of deaths every week, more than double where we were just this past June and July in terms of COVID deaths. So disheartening to say the least that we would be double where we were just a few months ago already before we really even get into the winter months. And I don't have a lot to say here on variants. Not a whole lot has changed. Still kind of keeping an eye on it. Still like 99% subvariants of the XBB, which is what our vaccine is tuned against. So at least we've got some good news there. Briefly, just taking a look at flu. Flu cases are just starting to increase. For the week of November 4th, we were at 3% positive specimens and about 1,900 hospital admissions. Now, remember, that's compared to almost 15,000 COVID hospitalizations, but still 1,900 hospital admissions for the week. And we know that, flu is seasonal. So we do expect to definitely see increases of this. So we'll start to see the burden of flu increasing from here. I'm sad to report that there was one pediatric flu death the week ending November 4th. And of course, we don't know the details about that death, but I will say that the vaccines do significantly reduce the risk of a bad outcome. And this year's formulation for the flu vaccine does appear to be well matched to circulating strains. It is recommended for everyone 6 months of age and up. Who we worry about the most as far as bad flu outcomes are those 65 and up and those 5 years old and under, as well as those who are pregnant. So those are the groups that are high priority for a flu vaccine, but again, recommended for everyone 6 months and up. If you're interested in more information about flu, there's a lot of great updated information on the CDC's Flu View, and the link for that is in the post. And turning to RSV, detections of RSV nationwide are heading up, just as they did about this time last year. There is a new preventative tool for RSV that you should discuss with your primary care provider if you're high risk, like if you're 65 and up, if you're pregnant, also for infants who are born during or are entering their first RSV season. There have been some access challenges with this new product. They're calling it a vaccine. It's not exactly a vaccine. I'm going to go over this more in a future briefing. But for now, if you're definitely falling into any of those high-risk categories or just in general, you should ask your primary care provider. You won't know unless you ask if they do have access to it. For right now, I just wanted to show that we are heading into the RSV season, it appears, with the upslope nationally. And again, if you look at wastewater in your own area, you may be able to see what's going on in your region, just as we are seeing it start to head up here in Oakland, California, in the wastewater. And I'll take this moment to say again that several counties here in California in the Bay Area have resumed mask requirements in healthcare settings, which I'm very grateful for. Although, as you probably know, I think this should be happening all year round since COVID is not seasonal and it is responsible for significant outbreaks with rapid spread. But this is definitely better than nothing. And I really hope other places in the country will do the same. And of course, it's not just healthcare settings where we should be interested in protecting ourselves and our loved ones. So something to consider for yourself, especially as temperatures get colder and the respiratory viruses start increasing, the doors and the windows start closing. Masks are an excellent line of defense. Especially if you're unable to control ventilation in indoor spaces, which is really just a travesty that we have not done a lot more to improve indoor ventilation. But of course, we want all the layers, and masking is also a very important layer. Now, I want to turn briefly to the issue of disparities within COVID. And this would really require hours to kind of go over some of the details and nuances with this because there's so many variables regarding COVID, vaccination status, and so on. And so when you look at different geographical areas, you do see different pictures as it relates to racial disparities. But when we look across the country, we look nationwide, we can see that communities of color are making up a disproportionate share of years of lost life during the pandemic. So this is something that we call excess mortality. And when you have an excess of years of life lost, this basically speaks to a disparity in how hard different communities were hit overall by the pandemic. And we can see this is just one way to look at disparities, but it is kind of the bottom line, if you will, because it really is about the overall life expectancy or reduction in life expectancy for a particular group. So when you look here, and this is from March 2020 to December 31st, 2022, this is basically showing each race ethnicity group. The share of the population of that race ethnicity group is shown on the left, and the share of excess years of life lost is shown on the right. And if you take a look at it, you'll see that both the white and Asian groups have a share of excess years of life lost that is lower than their share of the population, whereas Black, Asian Pacific Islander, Hispanic all have rates or share of excess years of life lost that are considerably greater than their share of the population. So all in all, people of color make up about 40% of the population, but account for 59% of excess years of life lost during the pandemic. And we can see that for Black Americans, literally it's double. So making up 13% of the population and 26% of excess years of life lost. So these kinds of disparities are tragic and a huge concern. And this is something that we had been watching really since the very beginning of the pandemic to see how these things were going to manifest. And I can say that here where I am in Alameda County, we started seeing these death disparities very, very early on. And we were looking at deaths specifically due to COVID. So not just overall share of years lost. It was too early to tell that then. But we were just looking at deaths from COVID itself. And we started to see from very early on in 2020 that there were big disparities, like African Americans dying at double the rate of whites in our county. And so we started partnering very early with our colleagues in the county and local hospitals. And we found out that even after controlling for underlying conditions, even after controlling for socioeconomic status and where you live and all of those things, we were still seeing those disparities. So we kept digging and digging, and today I'm going to share with you some of what we found and what we're doing about it. Chances are you have seen one of these devices. It is called a pulse oximeter. It measures the level of oxygen in your blood, and it can warn you if your blood oxygen level is too low, indicating that you may be in medical danger. It is a great device that can help save lives, and that is why you can find it in every hospital, every doctor's office, every clinic, every ambulance in the country. You might even have one in your home. You can buy them in most pharmacies over the counter. You can buy them online, but there is a problem. The pulse oximeter device is not reliable on people with darker skin. In fact, the pulse oximeter systematically, routinely overstates the blood oxygen levels of people of color, indicating that they are healthier than they actually are. And this is a huge problem. It's a problem that might have led to delayed or denied medical treatment for hundreds of thousands of people during COVID alone, not to mention all the decades prior to COVID for other issues where we use the pulse oximeter device to determine a person's oxygen level. It is likely that many people of color have died because of erroneous pulse ox readings. And to make things even worse, the makers and the sellers of the pulse ox devices have known or should have known that their products could not be trusted to work accurately on people with darker skin for at least a couple of decades, and yet they did not lift a finger to fix the problem or warn anyone about it. And that is why Roots Community Health Center is taking leading manufacturers and sellers of the pulse ox device to court. We are demanding that they fix their devices so that they work on all people, including people of color, or that they at least warn people who are purchasing them, or hospitals or clinics that are purchasing the devices, that they are unreliable when used on non-white skin. Roots is suing some of the nation's largest players in the healthcare industry because they have peddled a product that has racial bias baked into it for far too long. So I feel I need to tell you what the healthcare device industry and the federal government has failed to tell you. Do not rely on the readings from a pulse oximeter if you have darker skin. Those readings may be falsely increased and wrongly suggest that you are healthier than you actually are. Let me repeat. Pulse oximeter readings, pulse oximeters may not work accurately if you have darker skin. We don't know why. For more than 20 years, the pulse ox industry and government regulators have failed to fix this problem or to at least warn you about it. Maybe the industry considered a flaw that only affected people of color to not be a flaw, or a flaw that wasn't worth addressing. Or maybe they thought the flaw would not be noticed, that the dots would not be connected, so long as the devices did not cause problems for white people. Or maybe the manufacturers and sellers feared losing market share if they spoke the uncomfortable truth, which is that their products reliably only work on white skin. The pulse ox industry's mistakes and inactions might have gone unnoticed even longer than they did, but then COVID hit. We all remember. Nationwide ambulance crews, hospital emergency departments, primary care physicians screened and triaged hundreds of thousands of patients, desperately trying to access care to determine whether each patient was sick enough to be given a hospital bed, an oxygen tank, a ventilator, all of which were in critically short supply at different times during the onset of the pandemic. And what was the device that was most used to screen and triage those patients? The pulse ox. In fact, the pulse ox reading is the only objective measurement that is used by ambulances to decide to bring someone to the emergency department, by the emergency department to decide whether to send somebody home, and whether they need to be admitted or receive oxygen or other treatment. Time and time again, people with darker skin were refused transport to the emergency room, or were turned away at the emergency room doors, or were denied supplemental oxygen, or were not offered a hospital bed or treatment simply because their pulse ox readings were falsely high. Almost certainly, some of these patients died for lack of timely care. The statistics suggest as much. People of color disproportionately suffered sickness and death from COVID. In fact, once we learned about the pulse ox defect, we collaborated with our partners at Sutter Health and UCSF to do this study, which demonstrates delays in care, including delays in hospital admission, oxygen, and other treatments as a direct result of the inaccurate pulse ox device. And there have been subsequent studies that have shown the same. Roots is suing the pulse ox industry because we have seen firsthand how flawed pulse oximeters endanger the lives of our patients and our community. There is no excuse for a medical device to be designed and then produced and then approved and marketed for widespread use without being tested on a variety of skin tones. And there is no excuse for that device to be continued to be sold, especially without any warning labels, long after it's known to not produce reliable readings when used in people of color. It's time for healthcare apartheid to end, and that is why we are going to court. But first, you need to be warned. I know I've given these warnings here before, but I'm here to be very clear so that you do not fall victim to the pulse oximeter's flaws. And I hope that you will also warn others. Do not allow yourself or a loved one to be denied transport or treatment based on the device. Ask questions. Bring our study with you if you have to. Bring whatever information you need, ask the questions, make sure that whoever is making medical decisions for you is fully aware of this issue. Sadly, there's not a device today that I can tell you is safe to use because they have not been required to demonstrate that they can be effective on all skin tones. Sadly, the only definitive way to know your oxygen level is by a painful blood draw from your wrist. And if you're in the emergency department with respiratory difficulty, that is an option that a physician should evaluate you for and see if that is recommended. Unfortunately, that is currently not an option for the emergency medical service or ambulance, and of course for home use. So my best advice at this point is if you would like to obtain a pulse oximeter or you already have a pulse oximeter device for home use, establish a baseline. And what I mean by that is see what your oxygen reading is when you're feeling perfectly fine. That way, if you're not feeling well and you check it again and there's a drop, you will know how many points it dropped, and that will be additional information that you can provide to the ambulance or to the emergency department and let them know about this issue. So that is number two. Advocate for yourself, advocate for your loved ones, bring the information, ask. Matter of fact, ask every time you get this pulse ox device used on you if that person is aware of the discrepancies in people with darker skin tones. We have to educate and spread the word because unfortunately it is not catching on fast enough. It is not well known enough, and nothing so far has been done about it. So I hope that you will advocate for yourself, establish a baseline, and please follow us to follow our lawsuit because we will be providing updates on what is happening. And what we are asking them to do is to label the device appropriately. Well, first is to fix it. But if they can't fix it, label it appropriately. And if they won't do that, then stop selling it. And if you have a situation, a pulse oximeter gone bad story, or some way that has affected you or a loved one, please do share it with us at admin@rootsclinic.org. And please stay in touch with us on this critical and evolving issue. So, in summary, we're kind of having a plateauing of several COVID indicators at a place that honestly feels uncomfortable to be leveling off at, with nearly 15,000 hospitalizations and 1,200 deaths every single week in the United States alone. I think we all have an expectation that cases will go up this winter, as they have every winter. And I'm hoping that those increases in cases don't have to result in big increases in hospitalizations and death. And I believe that they don't have to if we are proactive, if we are up to date with vaccine boosters, particularly those at high risk of a bad outcome, and if those who are eligible get treated. That was a lot of ifs. So this is something we need to be proactive about, making sure that people who need to get boosted get boosted. It is available for everyone. It is going to provide better protection against the currently circulating variants, and it's going to provide the best additional boost over the coming months, where we do expect increased transmission. And then the getting treated part, as I say every single week, if you're someone who should be treated, if you catch COVID, then you should know that in advance, like now. And you should have a testing plan, a treatment plan, and a caregiving plan in place. Here are the available outpatient treatments. Getting them might take some coordination. We've seen and heard this time and time again. And you don't want to be doing this legwork when you're sick and you really only have a few days to get it done. So please get this figured out ahead of time, like now. COVID is still with us. It is still causing sickness, disability, and death, and there is still a lot we don't know. And the season for influenza and RSV is just getting started. So let's keep up our best practices to prevent the spread of all respiratory illnesses and prevent outbreaks. Stay up to date on your vaccination. Remember, no one layer is foolproof, so we want to implement multiple layers. Vaccination, high quality filtration mask like an N95 or KN95 or KF94. Whenever possible, gather outside. Outdoors is almost always safer than indoors. If you must gather indoors, try to assess that indoor ventilation and filtration, and also do what you can to prevent outbreaks like pre-event testing and requiring masking, etc. If you've had COVID once, it's better to not get it a second time. If you've had it twice, avoid a third time, and so on. There is mounting evidence of cumulative effects of repeat infection, and there's not seems to be any limit to the number of times you can catch COVID. Following COVID, we're seeing increased risk of impacts on almost any and every organ system. We're seeing new onset diabetes, blood clots, heart attacks, strokes, memory issues, worsening asthma, and I could go on and on. And this is in a subset of people, but we have no way of predicting who. This could happen after the first infection, but maybe not until the second or third. Catching COVID once and doing fine is not a guarantee about the next time. And every infection is a new opportunity, maybe even a compounded opportunity for long COVID and post-COVID impacts. So if you don't feel well, please stay home and rest, get tested so you can make an appropriate plan to not spread what you have to others and to get treated if it's appropriate. If you do come up positive for COVID or even for flu, please get treated if it's indicated. Do what you can to avoid household spread, and please test negative before you go back around others, because in general, when it comes to our antigen test, enough virus to detect is enough to infect. And if you don't have a primary care provider, please get one. Know how to reach them before you need them. Please remember to eat a balanced diet, incorporate fruits and vegetables, whole grains, avoid those sugary drinks, consider a multivitamin supplement, get some regular physical activity, get some fresh air. If you're sick, please get your rest. And also go visit that doctor, get your blood pressure and your baseline labs checked, like sugar, cholesterol, and vitamin D. Manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. We look forward to seeing you next Tuesday at 10 a.m. See you then.